Well, let's go ahead and get started. I want to welcome everybody for joining us today for the next webinar in our super series at MetroEHS. Today, we're going to be talking about unlocking the mysteries of the IEP. And I'm so excited to have Dawn and Megan here, and I'm going to let them introduce themselves. But just ahead of time, I want to put in my affirmation that these two ladies absolutely know what they're talking about, and you guys are in for a treat. And if you have any questions following their presentation, please feel free to let them know and they'll be happy to answer those questions. As all of our other webinars go, we're going to have this one up on YouTube very soon. I will also send you a link of this webinar as soon as we get that up and running, so you'll have access to it to refer back and just to recognize their faces because they're so great. So thank you so much. Megan and Dawn, please take it away.
Hi, everybody. Thanks for joining us today. I'm going to get my screen shared with you while Megan and I introduce ourselves. So I'm Dawn. I am a BCBA and also a former special education teacher. So this was a career change for me. I came from the education system into ABA and behavior analysis. So I've got lots of experience. I taught for many years, more than I'd like to share, because then you'll all know how old I really am. And then I've been in this field, in the field of ABA, and working with children with developmental disabilities for another 10 or so years. So start putting together how old I am. Keep it to yourself, please. But we've got a lot of information to share with you from our expertise in both fields. And then we also have Megan.
Hi, I'm Megan. I have a very similar background to Dawn. I started out my career in education. I was a general education teacher and then pursued a master's degree in education and special education specifically, and was a special education teacher for quite a few years before taking a little break to stay at home with my own children. And then I entered the wonderful field of applied behavior analysis, fell in love, and pursued my board certification. And I have been in this field for, more than 10 years and love every minute of it. So I think, Dawn and I have been able to have the best of both worlds.
Absolutely. So that's what we want to share with you today is our expertise on both sides of the table, as teachers who are familiar with the special education process and individual education plans, but also as clinicians who are now supporting families in the transition to school from direct therapies, if your family is participating in those. So today we're going to discuss unlocking some of the common IEP mysteries and some things that you need to know.
So first, you need to think about, does your child have a medical diagnosis of a developmental disorder? So, and it could be any diagnosis. It could be autism or some other developmental disorder. If yes, then you need to be contacting your local school district. And when you do that, you will be requesting our special education evaluation. You have to request this in writing. It just is added protection, added documentation that you are requesting that your child get a review to see if they qualify in schools for an IEP. And once you do that, they have to evaluate your student, your child, within 30 school days. And then they would go through and they're going to complete that evaluation. And that will be what we call a multi-evaluation. And that includes a school psychologist, possibly a speech and language pathologist, possibly an occupation therapist, and a teacher consultant could observe, a social worker could observe. And so it'll be a team that will be coming together to complete an evaluation to see if your child qualifies for special education in school. It is really important that this process begin well before the age of 6. Once a child turns 6, it is no longer a choice. You have to legally send your child to school. So if you have a younger child, 3, 4, 5 years old, it is important that you begin looking into and reaching out to your local school district to start the process. And this process can begin as early as age 3. Many of our local districts have programs in place for an early childhood special education classroom and services for children who are as young as 3 to start getting them accustomed to a classroom situation and education. And so if you would like for your child to start receiving some educational opportunities in your local district, you can reach out to your local intermediate school district about the age of 3-4 to get that process started.
So as Megan was just briefly discussing, the evaluation process is exactly that. It's a process. So why we recommend to get this started as early as you possibly can, especially if your goal is to be in school by age 5 or 6. You want to have enough time to really have a solid plan in place before you actually send your child off to school. And this evaluation process is completed every 3 years. So when you're going in for your first IEP, your first enrollment in school, this is part of the process. They will have to complete evaluations related to the developmental disorder that your child has been diagnosed with. And that team typically includes all of the individuals on this chart. Every once in a while, occupational therapists may not be involved or speech pathologists may not be involved, but at a minimum, there is a school psychologist involved in the multidisciplinary evaluation team, typically a school speech pathologist, a school occupational therapist, a school social worker. The special education teacher and also general education teachers have been known to participate in evaluating the child to determine exactly what their strengths and weaknesses are, and what eligibility in the school system they may fall under. And these evaluations and the results of these evaluations help drive the creation of the individualized education plan. So this is the beginning of developing that plan.
So what to expect? So prior to the evaluation, you should plan to meet with the special education department to provide consent for the evaluation. And there's also what is called a read, which is just a review of any existing evaluation data. So part of that consent is you are giving permission for a school psychologist and or a speech language pathologist, occupational therapist to complete an evaluation to kind of determine where your child is at. You'll be asked to complete several different questionnaires, for example, possibly a sensory profile, and then all of those documents will be returned prior to the actual evaluation appointment. The school districts really want your input. They want to know what you are seeing at home, any background information you can provide. All of the information that you provide to the school psychiatrist and that team will help to develop that plan that will help your child be more successful in school. Evaluations can occur over several days with a variety of different evaluators. Once all of those evaluations are completed, then you will be invited to another meeting, and it'll be called the MET meeting. And the MET stands for Multi-Evaluation Team Meeting. And this is often completed at the same time as that IEP or that individual education plan meeting. And this meeting just reviews all of the results of all of the evaluations that have been taking place over the last couple of weeks, and it discusses what eligibility your child has in the school system. So they take all of that information, including your input and anybody's input that you would like to include, and they determine what is going to be the best placement for your child, whether it be a special education room, if you're an autistic, an ASD or an autistically impaired room, a cognitively impaired room, if they're going to be part, general education classroom with just some support services. And so that's where all of that data will be discussed and the team will come together to determine eligibility. A MET is typically completed every 3 years, where an IEP or an individual education plan is completed every year. But the entire evaluation process and the eligibility determination occurs every 3 years.
So as Megan mentioned, the IEP or individualized education plan is done in conjunction with the MET initially, and then however is completed annually on the years that we do not have to have an eligibility determination. So Once the evaluations have been completed and eligibility has been confirmed, then the IEP is created with family involvement. So not to be super repetitive, but it is incredibly important that you all as family and caregivers, you're able to give input and as much insight into the child as possible, because there's no better expert on this child than the parents and caregivers. So it will really help the team develop a significant, a valuable plan for both you and your child. This plan it's a living document, and it covers all of the educational needs and goals during the school year. So everything that your child may need, you want to have this specified in this plan, because it is designed to be a year-to-year kind of plan. This plan, as Megan mentioned, it also will include placement. So exactly what kind of classroom your child will be placed in. If it's a hybrid situation where we're going to be in general education some of the time and in special education classrooms some of the time, those percentages are placed in the IEP so that it's very explicit. This amount of time in this classroom, this amount of time here with this many support. And the consideration for placement it's very important, and it's based on the principle of making sure that students are placed in what's called the least restrictive environment. So what that really means is that the child's results and all of the input from the parent and family, this team will focus on finding a classroom, whether it is in the local district, your neighborhood school, or another building within that same district that has the exact right classroom for your child. And what that means is that in this classroom, they can be as independent as possible. They can access the curriculum, they're engaging in learning, they're able to engage in learning because there's not something else that's competing with that. It's not an overwhelming situation. If a child needs support, we wouldn't want to put them just in a general education classroom with no support. That would be restrictive for them, because they would not be able to access the curriculum independently or navigate that independently, or vice versa. If we have a child who is showing that they're ready to be more independent and can go into a larger classroom with less support, then we want to make sure that's happening too. The essential piece is that families work with the school to help determine what is least restrictive for that child. Also added into the IEP are any accommodations and additional services that your child will be receiving. So placement, classroom and academics, but if your child has qualified for social work or speech therapy, those frequencies and services will be listed, as well as any just classroom accommodations. If the child needs sensory breaks throughout the day, or if they need extended time for assignments or assessments, things of that nature, they're all explicitly stated in the plan, because that's what's going to help them be successful.
So this is just a quick guide, as you enter the world of, special education and just even in our field of applied behavior analysis, we use a lot of, acronyms, and we just want to identify the difference between what the MET is and what the IEP is. So the MET is the multi-evaluation team meeting, and that is an evaluation process that is completed every 3 years, and it involves multidisciplinary team members. And it also includes you as a parent and anybody that you would like to bring with you to those meetings. So oftentimes as BCBAs, our parents would like for us to join those meetings because we are able to speak on, different skills and different concepts, just different learning tools that your child would be, is successful with. Sometimes when a team is just meeting a child for the first time, they may not have an accurate depiction of what a child can and cannot do. So you as a parent are allowed to bring whoever you would like to those teams. And that meeting occurs every 3 years. The individual education plan is just that annual individual education plan meeting. And once again, you as a parent are allowed to bring whomever you would like to those meetings as well. The IEP specifies those annual education goals. It goes through, the specific goals that were set forth when the child first started school or for that school year. And then it'll talk about if the child mastered those goals, and then that would determine any new goals that they would be implementing for the following year. Whereas the MET, that talks about more of the evaluation and the eligibility for special education services and placement.
So we've collected a few common questions that we've both gotten, both on, both sides of the table, as being an educator conducting the IEP meetings and setting goals, but also as the clinician who's now assisting with families transitioning into the school setting. So these are just a few of the most common questions, but one of the biggest ones is who am I allowed to invite to the IEP or MET meeting? You can bring anyone. You can bring significant others. You can bring any other person that you identify as a primary caregiver. You can bring, if your child has additional therapies, your BCBA is welcome to attend if you choose. If your child sees a mental health therapist, it's your discretion who you want involved in that meeting. Another question we get a lot is, what if I don't agree with the IEP? And this question can be unpacked a couple of different ways. So, what if you don't agree in general with the eligibility or the placement? One thing you can do is request an independent evaluation. Again, disclaimer, anything that you do or in relation to evaluations and such, put everything in writing. That way there's, you've got the date that you requested it, and, nothing can get lost in the shuffle because it's a written request. But you can request that outside independent evaluation to get a second opinion. Alternatively, if you feel that the evaluation process was pretty good, but you have questions about some of their strengths or weaknesses or accommodations that are being suggested, you can request a teacher consultant observe. Most districts they may be called a variety of different things. Sometimes they're teacher consultants, sometimes they're behavior specialists. There is a role in most districts where an additional person on the special education team can come in and observe and see if they're also in agreement with the accommodations, or maybe they have new ideas that they're able to bring to the table and further assist that child with being successful in a classroom. You can also seek an educational advocate. So there are individuals out there that one of their sole jobs is to know the special education laws inside and out and to be an advocate for students in that educational realm. So if you particularly feel that an IEP is really off base, or subsequently, if you have an IEP and you feel that it is not being executed the way that it was written, you can also seek an advocate to assist you with ensuring that the IEP is followed the way that it was written. Which also leads us into another really big question we get: is that annual IEP set in stone? Absolutely not. You as a parent caregiver can request an IEP meeting at any time to do an amendment, and that could be for, your child is meeting all of their goals and you want to establish new ones to keep that constant forward growth. Or alternatively, and we truly hope this isn't the case for any of you that are in this process, but if accommodations are not being met for some reason, or least restrictive environment, your child is not in the appropriate placement, what do? We go in and we can amend that IEP, and you can request that at any time. Again, submit it in writing, and in that scenario is when you may want to have additional participants, such as an educational advocate. Those individuals can be found. The Michigan Alliance for Families has resources on how to find an advocate, and there are some just independent contractors, not quite the right word, but there are advocates that are well known in the state of Michigan that this is all they do, and you can find them on the internet, and so there are resources. If you're not comfortable with something in your IEP, and you've already exhausted all of your options with the district, you definitely want to be very communicative with the district that your child is receiving education in. Let them know all the things that are going well, all the things that you wish would be different, or it's got to be an open communication. But if you have exhausted all your options, there are still options outside of the district that can support you in navigating this very complex situation.
And just to add to that too, is that in both a Met and an IEP, it is a team. You are working with all of this team of professionals who want your child to be successful in the classroom and in an educational setting. And so, and you have, as a parent, have every right to, to express, concerns or, advocate for your child. And the team is there so that it can be determined what your child's least restrictive environment is and where your child would be able to best gain skills and thrive educationally.
So if you are interested in more information, you can contact MetroEHS Pediatric Therapy. Our main number is listed there, and also our website. We do have, as Karen mentioned when we first logged on, we do have a YouTube channel where we are posting information, very often on a wide variety of topics. But this presentation will be uploaded to that as well. So feel free to watch it back through or reach out to us and call in and ask to speak to Megan or myself. But we're definitely here to provide education and try to help you guys out.
Thank you guys so much. That was so much great information. I truly appreciate it. One of the questions that came in, and you guys both kind of touched on the advocates that help parents and finding that advocate to help a parent with an IEP. But one of the questions I wanted to throw out to you guys is, what happens if a school tells a parent that they don't have the proper room or accommodations for the IEP at that location? What does that parent do, and what can they do in that situation?
Yeah, in that situation, the school has the obligation to locate an appropriate placement and then subsequently also provide transportation to and from. So just because your local neighborhood school doesn't have the right classroom, but a sister school in the same district might have it, then the placement should move over there. And the schools are required to provide transportation if that's the case. And then there are other potential cross-district relationships where, if the home district really does not have a suitable placement for that kiddo, that would be their least restrictive environment, then they may go to a district, an entirely different district that can better suit their needs. And again, that curb to curb transportation is part of it. So the burden should not be falling on the parents, and the school should be working with families to locate the most appropriate placement.
Great. Well, that's probably a relief to a lot of parents. Thank you, Sonia. Sonia said, thanks so much. My daughter has an IEP for a few years now, but having more information is always great. I'm looking forward to inviting her OT to our next meeting. Yep, good. See, you've already got those tools at the start of the school year. And now and hopefully more of our parents will know once they watch this, that it's not just them versus the school, that they can have advocates and therapists come and help. So I appreciate this so much, Dawn and Megan. Just for everybody out there who's watching, we have other great webinars full of information with our professional therapists who have done all of these things their whole lives, and they truly can offer you a lot of great tips and great help. So please tune in to MetroEHS on YouTube. Stay tuned on Facebook, for we'll post this and we'll be in touch. Thank you so much and have a great afternoon. Bye, guys.
Bye. Thank you.
Bye.